Hello, everyone, and welcome to today's session on understanding quality expenditures and budgeting. During this session, we want to demonstrate acceptable expenditures in each of the 10 allowable quality activities. My name is Shar Shank, and I am a Technical Assistance Specialist with the National Center on Tribal Early Childhood Development, and I'm joined by my colleague and a former CCDF Administrator, Chris Woodring, and I'm going to pass it off to Chris to introduce himself.
Hello, everyone. My name is Chris Woodring. I was a CCDF administrator for a small allocation grantee in Michigan for 7.5 years. I had the blessing of my tribal leadership to build our program from the inception of receiving CCDF funds and provided direct services through a certificate program. I am now a technical assistance specialist for the National Center on Tribal Early Childhood Development along with Shar. I'll now pass it back to Shar to get us started.
Thanks, Chris. Today's session objectives are review the requirements of quality spending, understand the flexibility of choosing quality activities, and explore the budget worksheet to budget for quality spending. Tribes of all allocation sizes, including those under Public Law 102477, are subject to the increasing quality set-aside. The requirement for quality set-aside for fiscal year 2019 is 7%, and the first 2 years in the fiscal year 2020-2022 funding cycle is 8%, and the final year, fiscal year 2022 and ongoing, the quality set-aside will be at 9%. Please note, these percentages represent the minimum set-aside. You can always spend more on quality if your budget allows. The minimum spending requirements for quality activities apply to the total funds expended each year, which includes the mandatory and discretionary funds minus the $30,000 discretionary base amount, rather than the total funds allocated. All tribes receive the $30,000 discretionary base, while tribal consortia receive $30,000 a year per member, or a prorated amount for a member tribe with fewer than 50 children. When creating a budget or plan for quality initiatives, it is important to understand just how much money could be set aside. For planning and projection purposes, you can look at your total funding award and subtract the $30,000 base amount, and then multiply the remaining award by 8% for fiscal year 2020 to get an estimate. Tribes with medium and large allocation sizes are also subject to an additional 3% infant and toddler set-aside spending requirement within this plan period. You can project the infant and toddler set-aside using the same calculation by just substituting the 8% with 3%. To ensure a strong fiscal management system through frequent and effective communication, the CCDF Administrator and the Tribe's Finance Department could use strategies of communication that include monthly finance meetings where expense reports are reviewed, budget development meetings to ensure cost categories are identified prior to the beginning of the fiscal year, consultation in the development of the tribal CCDF plan, and also invite fiscal staff to CCDF training and coordination in completing fiscal reports. Now let's transition to discuss with a former CCDF administrator on the 10 quality activities. The first activity I want to discuss is training and professional development. Chris, did you choose this activity in your CCDF plan when you were a CCDF administrator? If so, what type of initiatives did you spend quality dollars on?
Yes, Shar, I have chosen this activity in my past CCDF plan. I utilized quality funds to train my providers by paying for online subscriptions, bringing providers together for face-to-face training and for CDA coursework.
Well, Chris, did you know that you could also use quality funds under this activity to pay for your health and safety training during orientation or pre-service?
I did not, but I wish I did. We were struggling with the cost of the annual fee for the website we use to ensure our providers are properly trained. Can I ask, what does training look like for tribal lead agencies who operate a tribally operated center?
Well, it's very similar. Tribal lead agencies can use funds to pay for staff to receive training on child development, curriculum implementation, screening tools, and pay for them to get their CDA. This quality activity is one that is commonly chosen by tribal lead agencies. The second quality activity listed in the plan is early learning and developmental guidelines. Chris, as a CCDF administrator, did you explore this option?
To tell you the truth, Shar, I didn't. I wasn't really sure how I could spend funds in this category. Could you tell me how this fits in with spending?
Certainly, Chris. This activity is a type of an initiative that tribal lead agencies could choose to implement. Initiatives are usually chosen based on assessment of needs in the community or interests from tribal leadership. Early learning and developmental guidelines define what children should be able to do and which age they should be able to do it. Some tribes choose to adopt early learning guidelines that has been developed by the state and then use quality dollars to print a copy for providers and to conduct training on the guidelines. While other tribes who work directly with Head Start or Early Head Start programs may adopt the Head Start Early Learning Outcomes Framework and use quality dollars for the printing and training as well. Furthermore, some tribes adapt early learning guidelines by infusing cultural criteria into guidelines developed by the state, Head Start, or other organizations. Hours spent on adapting the guidelines, printing copies, and training providers are all costs that can be billed to quality initiatives. And finally, some tribes choose to develop their own early learning guidelines. Hours spent on the development, printing copies, and training of providers are allowable quality expenditures. Is this something your tribal lead agency may have considered?
No, we really didn't. But CCDF administrators should keep this in mind when talking to their tribal leadership in the future. I know many tribes want their CCDF programs to infuse culture into their services.
Yes, it would be a good idea for them to keep it in mind. The next approved quality activity in the plan is to develop quality rating and improvement systems, or otherwise known as QRIS. This activity involves creating a measurement of quality, something that would be used to assess the quality of childcare services in each of your provider settings. Some tribal lead agencies use state licensed providers who may be a part of the state's QRIS. A tribal lead agency could provide a rate add-on based on the provider quality rating from the state QRIS. This rate add-on could be a use of quality funds under this activity.
Has any tribe considered developing their own quality rating and improvement system?
Yes, there is a tribe with a large allocation that is in the process of developing their own QRIS. They are using quality funds for the hours spent on developing the assessment criteria, determining how many levels of quality there will be, and what quality indicators will be met to achieve each level. Once the development is complete, they plan on using quality funds to pay rate add-ons to the providers who have met the levels of quality outlined in the policies and procedures.
Wow, that sure is a great use of quality funds and a way to incentivize meeting quality milestones.
It sure is, Chris. This activity is usually chosen by tribes with large allocation sizes since they are working with many providers, unless a tribe would choose to partner with other tribes who are located in close proximity and create a shared QRIS. In this case, the cost of development would be shared with all participating tribes.
Shar, I worked for a tribe with a small allocation and was not required to spend funds on infant and toddler activities. We focus primarily on preschool age children. Can you share with me how spending for quality activities would differ for infants and toddlers?
Sure, Chris. Thanks for mentioning that tribes with small allocation sizes do not have the requirement to spend quality dollars on infant and toddler activities. However, they could choose to do so, and the spending would count towards their minimum quality expenditures. However, tribes with medium or large allocation sizes are required to spend a minimum of 3% on infant and toddler activities each year. Infant and toddler quality activities are similar to the other areas we've already discussed and ones we will continue to discuss. For example, you could choose to develop infant and toddler early learning and developmental guidelines. The spending options would be the same, only you would code them to the infant and toddler quality activity instead of the early learning and developmental guidelines quality activity we previously discussed. Another example would be to provide training and professional development opportunities specific to infant and toddler care. The training activities could be coded to the infant and toddler quality activity. Does this help you to identify the difference, Chris?
Thanks, Shar. So you are saying that any quality activities that are specific to the infant and toddler age group can be considered a part of the infant and toddler quality activity?
Yes, Chris.
Thanks for clarifying that. Another quality activity I was curious about was the child care resource and referral services. As I said earlier, we were a tribe with a small allocation size. How would this quality activity pertain to us?
Great question, Chris. First, let me explain what a child care and resource and referral service is. Basically, a child care resource and referral service is a way to assist parents in finding quality child care providers for their children. In most cases, the CCDF staff who complete the application process with parents usually provide that service to families by informing them of all the child care options available within the tribal community. Other tribal lead agencies who use state licensed providers may refer families to the state's child care resource and referral agencies to assist them in finding care. While some tribes with large allocation sizes who offer all types of care choose to implement their own child care resource and referral services system to assist families. A tribal lead agency could choose to develop such a system as a quality initiative and use quality dollars to pay for time spent in the development, maintaining a website or other system, paying for staff and updating the information, as well as printing any promotional materials. Usually, tribes with small or medium allocation sizes do not choose this activity.
Thanks, Shar. That really helped me understand what a child care resource and referral service is. I see the next quality activity listed in the plan is the licensing and health and safety requirements. This is an activity that I always marked in my CCDF plan. It was important to our tribal leadership that we made sure that our children in care were safe. I usually spent quality dollars in this category on replacing or repairing broken equipment, safety equipment, or replacing surfacing material under our playground equipment. What other activities would fit in this category?
Thanks for your examples, Chris. Those are important health and safety expenditures. Besides purchasing items, some tribal lead agencies use quality dollars within this activity for health and safety initiatives. And here are some examples. Some tribal lead agencies use quality dollars to create a licensing system so they can license their own providers to ensure they follow the health and safety standards chosen within their CCDF plan. So, time spent on developing the licensing requirements, developing the checklist used in monitoring, and licensing visits could be expenses coded to this quality activity. Another tribal example is to develop a monitoring system, maybe not as formal as a licensing system, but a process to ensure all providers are meeting the health and safety requirements. Expenses could include the time spent in the development of the system, monitoring visits, and developing monitoring reports, as well as printing the health and safety standards for providers, monitoring checklists, and mileage to and from the monitoring visits. Also, one tribe utilized quality dollars to implement a fencing initiative for their family child care providers. They found that children were exposed to busy roadways, stray dogs, and other environmental hazards, so they felt it was necessary to install fencing to provide a safe space for children to play outside. This initiative was completed in stages over a few years. As you can see, Chris, tribes have many options for using quality dollars under this activity.
Wow, I can see how a tribal grantee could spend most of their funds within this one quality activity.
Now let's talk about a couple less chosen quality activities. The first activity is quality evaluation. This activity involves evaluating a child care provider. For example, if a tribal lead agency wants to find out what the quality of care is for each provider and they do not have a QRIS system, they could choose to use a research-based tool. Some examples of tools are the ECRs, ITERs, and class scoring systems. Tribes could hire a consultant who is trained in an evaluation tool to go into each provider or each classroom in the tribally operated center to have the evaluation completed. They could send a staff member to training in the tool, and they could pay the staff time related to conducting the observations to spend quality dollars in this category. The second is accreditation. This activity is usually chosen if providers or the tribally operated center has reached the highest level of quality based on a QRIS or through quality evaluation. Programs of the highest quality may reach out to a national organization such as the National Association for Education of Young Children and the National Association for Family Child Care. There is an example of a tribally operated center in Arizona who has reached the top level of the state QRIS system. That tribal lead agency may choose to utilize this quality activity and get the tribally operated center accredited with one of the national organizations. I've also heard that some states allow child care programs to bypass some of their QRIS steps if a program is currently accredited by a national organization.
Thanks, Shar. This clears up some questions that I had. Shar, I see the next quality activity is listed as high quality program standards. My program adopted the minimum health and safety standards as the standards we were going to require our providers to follow. Knowing that we wanted to adapt them moving forward, we just didn't have time before the CCDF plan needed to be completed. Could my tribe use quality funds to move forward with that plan?
Yes, Chris. The tribe could use quality dollars to pay for the time spent on researching possible additions to the health and safety standards, time writing the standards, printing the standards, and training providers once the standards are completed. Standards may also reflect other best practices and the unique cultural practices and expectations that exist within the community. As they consider the best approach for developing standards that meet the final rule requirements, we encourage them to seek input from the tribal governing body, providers, parents, and community members. They can provide a unique perspective to help you ensure that standards meet the specific needs of the providers, families, and children served.
Thanks, Shar. I'm going to do some research on other health and safety standards I've heard about, like the Caring for Our Children Basics. Maybe they could use the information from that source to begin the process. Or they could possibly reach out to a retired CCDF administrator for consultation.
That is definitely a great place to start, Chris. The last quality activity listed in the plan is categorized as other activities determined by the tribal lead agency. Activities chosen in this category must be measurable, so measurement of outcomes related to the improvement of provider preparedness, child safety, child well-being, or entry into kindergarten is required for such activities. The plan also lists 3 distinct other categories: culturally relevant activities, consumer education, and other. Let's talk about culturally relevant activities. Tribes may choose measurable activities to infuse culture and language into their child care programs. Chris, do you have any examples you'd like to share?
Sure, I would love to. I have heard that some tribes use this quality activity to pay for staff time to infuse culture into their curriculum, create language immersion programs, or to create recipes to make cultural food within their nutrition program.
Chris, do you have any more examples of the other activities?
I do, Shar. Since we were a tribe with a small allocation, we used quality dollars to advertise our program. We would print flyers, do radio spots, and put articles in the tribe's newsletter. Do the cost of those activities fit under this quality activity?
Yes, Chris, the cost of printing the flyers, time spent on the radio, and writing the newsletter articles are allowable costs within this category. Another example used by some tribes with medium and large allocations is maintaining a CCDF website to post all of their information on. The cost of developing, hosting, and updating the website are other costs that could be charged within this activity.
The one thing I am a bit confused about is what makes an activity measurable.
Good question, Chris. To be measurable, the activity needs to show that provider skills have increased, children's learning has improved, or the child care environment is safer. For example, if you choose to infuse culture into the curriculum, you could measure the outcome by looking at child assessment scores to see if children's learning has improved. Or you could decide to create a language immersion program. You could assess the progress the children are making in language fluency. Do these examples help you, Chris?
Yes, I understand now.
Now that we've talked a bit about each quality activity, let's open the budget template to see how CCDF programs can plan for their quality spending. You may recognize this budget sheet from our on-demand session demonstration of the budgeting template. We're going to specifically focus on the sections that pertain to quality. It is best practice to develop your budget prior to the start of the fiscal year, normally around August or September, for an October 1st start date. Let's move the layout on the screen now. Starting at the top of the sheet, let's look at the area highlighted in pink. This grantee's total grant amount is $285,000 for this fiscal year, which makes them a tribe with a medium allocation. Then they subtracted the discretionary base of $30,000 highlighted in blue, which left $255,000 highlighted in lighter pink to base their predictions on. Moving down to the orange section on the sheet, this grantee used the sample budget sheet to project the 8% quality spending. The minimum amount required in the fiscal year 2020 and 2021 to be $20,400. And the next row, highlighted in green, they have projected the 3% minimum for infant and toddler initiatives, which is a requirement for all tribes with medium or large allocation sizes, to be $7,650. It is important to remember the percentage of quality expenses required for each fiscal year is based on the amount of money grantees have spent out of the fiscal year's budget. For example, this grantee's award was $285,000 per year. They subtracted the $30,000 base amount, leaving $255,000 that they multiplied by the 8% and 3% respectively to project that they would spend $20,400 on quality activities and $7,650 on infant and toddler activities. But if this grantee only spent $235,000 and did not spend the $30,000 base amount, The required quality expenses would be based on the $235,000 that they spent rather than on the $255,000 that they were awarded. Their requirement would only be $18,800 for quality activities and $7,050 for infant and toddler activities this fiscal year. Many times, grantees have funds from previous years left over. It's important to create a separate budget sheet for each year's remaining funds to ensure the grantees meet the required obligation and liquidation periods. Within those budgets, you may have quality funds that need to be obligated or liquidated. It is good practice to utilize the oldest funds before spending out of the new fiscal year. In your tribal CCDF plan, you have determined what quality activities your tribal lead agency is planning on implementing and have projected the amount of money you will need to spend. Let's talk more about how to break it down by each specific budget activity.
Shar, you mentioned earlier that this budget is for 1 year. What if my tribe chooses an initiative such as adapting the minimum health and safety standards and adds additional information from caring for our children's basics? I don't think the project could be completed in 1 year. How would I budget for that?
Good question, Chris. Many times tribal lead agencies choose more of an initiative instead of a 1-year activity. This was demonstrated earlier in the example of the fencing project for family child care providers. The tribal lead agency did not have enough money in their budget to install fencing for all of the providers in 1 year, so they prioritized which providers had the highest safety risk and started there. They only added the cost of the first round into the current year's budget. The entire cost of the initiative were spread over multiple budget years. Another example of an initiative would be infusing cultural practices into the curriculum. This initiative may take more than 1 year. A tribal lead agency will only budget for the time staff or consultants will spend on the project during the fiscal year. Do these examples help, Chris?
Yes, thank you.
Okay, let's move down the budget sheet. You will see the quality section that has multiple highlights. We will talk about each row in a minute. In the left-hand column, you will see the quality activities this tribal lead agency has chosen in their tribal CCDF plan. Going down the list, they have chosen training and professional development, infants and toddlers, health and safety, high-quality program standards, culturally relevant activities, and consumer education. It is important to only budget for the quality activities listed in your tribal CCDF plan. While the other activities are allowable, if the tribal lead agency does not select them in their tribal CCDF plan, they become unallowable unless the tribal lead agency completes a plan amendment within 60 days of the beginning to spend in the quality activity category. Looking at the row highlighted in orange, training and professional development, this grantee has projected that they will spend $1,306 in mandatory funds and $3,500 in discretionary funds. This budget category will include any training and professional development costs, including travel for training, training hours, and materials. Now let's look at the row highlighted in green, infants and toddlers. This grantee has projected to spend $7,650 out of discretionary funds, which matches the amount calculated in the green section above on the budget sheet. Now let's look at the row highlighted in pink. They have budgeted $7,124 out of discretionary funds and $10,000 out of the discretionary base amount for health and safety activities.
The amount of money budgeted in the health and safety line sure does seem like a lot of money. Why do you think they budgeted so much?
That is a good question, Chris. I assume that this grantee has planned several health and safety projects for this year. possibly designing and developing their own monitoring system, or creating a fencing project like the example we spoke of earlier. It is important to have a plan for each budget section as you fill in the dollar amounts in the budget sheet. Okay, let's talk about the turquoise row, high quality program standards. This grantee has budgeted $2,700 from the discretionary funds and $2,500 out of the discretionary base.
Why do they break down their budget by mandatory, discretionary, and the discretionary base? Wouldn't it just be easier to enter one amount?
Yes, it would be easier to enter just one amount, but by breaking it down, this grantee can track each of the categories of funds they will report in their annual 696T report, making the reporting process easier. Now let's look at the purple highlighted row, culturally relevant activities. This grantee budgeted $4,409 out of discretionary funds and $7,500 from their discretionary base amount. All measurable cultural activities would be included in this line item. And finally, the blue highlighted row, consumer education. This grantee budgeted $591 out of mandatory funds and $500 out of discretionary funds for this fiscal year. The row at the bottom of all quality activities subtotals the amounts for the mandatory, discretionary, and discretionary base funding categories highlighted in purple. As you can see, the total amount budgeted for mandatory funds is $1,897, $25,883 for discretionary funds, and $20,000 for the discretionary base. The total funds budgeted for quality activities is $47,780, highlighted in orange, which is more than the total quality requirement of $28,050. Remember, the quality funding requirement is a minimum, and tribal grantees can choose to spend more on quality activities if they wish. As you move through your fiscal year, your finance department can provide you with expense reports. These reports can be compared to your budget you develop to ensure your program is spending accordingly to your planned activities. If you see that you're off track, you can adjust based on new priorities. A budget is really a plan and can be updated within the year if your priorities change. This sample budget sheet is available to tribal lead agencies, including those operating under Public Law 102477, by requesting TA through your regional office. Your NC TECD TA specialist can assist you in developing a budget by adding your grant awards into the budget sheet, creating additional pages for more grant years and/or the CARES Act funds, and walking through calculating your budget projections. We are always happy to provide feedback as you go through the budgeting process. Now I'm going to pass it off to my colleague, Chris, to share a little bit about other on-demand sessions.
Thank you, Shar. This concludes our on-demand session 5 on projection of the quality expenditures and budget template. This session is one of a 5-part fiscal series. Our other sessions include Session 1, CCDF Fiscal Management and Introduction. Session 2, Using your CCDF plan and other tools for justification purposes. Session 3, Demonstration of the budgeting template. Session 4, Demonstration of the projecting CCDF spending for direct services tools. You can complete this series by visiting our website. Additional resources have been provided to support you with fiscal management. Please download from the landing page a copy of the action planning template. We also have the Appendix C of the new Administrator's Guide available upon your request. If you would like to request technical assistance, please reach out to your Office of Child Care Regional Office, and your program specialist will be happy to assist you. If you are a Public Law 102477 grantee and would like to request technical assistance, please reach out to your Office of Child Care Regional Office and copy your Bureau of Indian Affairs representative. Thank you for joining this session. We are so glad you took the time to listen to this information. Please feel free to reach out to us with any questions. Miigwech. Thank you.